Hello and welcome. I'm Jess the Nurse Practitioner, and this is Ask Jess the NP. Hey y'all, welcome to the very first episode of Ask Jess the NP, the place where we talk real life, real health, and real solutions. I'm Jess, your favorite nurse practitioner, and today we're diving into the topic that touches so many of us, anxiety. Whether you're struggling yourself or supporting someone who is, this episode is going to break it all down in a way that makes sense. Move this. Sorry. A little bit closer. Okay. So let's get into it. What is anxiety? So you may hear terms like generalized anxiety disorder, panic disorder, or social anxiety disorder. It's basically your body's natural response to stress. We all get anxious from time to time, which is normal. But when anxiety becomes a chronic, overwhelming, or starts interfering with your everyday life, this is when it may be classified as a medical condition, like generalized anxiety disorder, panic disorder, or social anxiety disorder. Some of the symptoms that you may experience are things like restlessness or feeling on edge, fatigue, trouble concentrating, muscle tension, irritability, or sleep issues. Sometimes it feels like your mind just won't stop, or like you're constantly waiting for something bad to happen. So that what we call impending doom type of feeling. How do we diagnose it? So we use a number of things, but most commonly we use the DSM-5, which helps to diagnose, and the GAD-7 for generalized anxiety disorder questionnaire. So you may have experienced this at your provider, where they ask you different questions about how you're feeling and what types of situations may make you have those feelings and things of that nature, to help them get a better understanding if these feelings that you are having are coming from true anxiety, or if they're issues that may be linked to other conditions like thyroid issues, vitamin deficiencies, or medication side effects, as those can also mimic anxiety. Let's see. So we will go into treatment. So we look at pharmacological and non-pharmacological. So we're going to start with pharmacological treatment. So these are things like our SSRIs, maybe medications that you've heard of like Zoloft, Lexapro, or Prozac. These are SSRIs. They typically are the first line defense as far as anxiety, and they are taken daily. Then you have the SNRIs. Those are things like Effexor or Cymbalta. You have buspirone, is a non-benzodiazepine that's used for generalized anxiety. And then you have actual benzodiazepines like lorazepam or alprazolam. Those are more for short term. So you may be paired with the benzodiazepine in the beginning, and then maybe an SSRI or SNRI at the same time. But the benzodiazepine is usually for short term while you get that coverage, because it takes usually 4 to 6 weeks for the full effect for like an SSRI or SNRI to get in your system, build up, and start taking its effect. So you offer some coverage from benzodiazepine. We don't do them long term because of their risk of dependence. So having that shorter time that you're using lessens the risk of dependence on those medications. You also can use beta blockers like a propranolol medication, which is generally used to decrease the heart rate. And so if your anxiety has that characteristic where your heart rate is increased, then you may be able to use a medication like propranolol, which will help decrease that feeling of racing heart, which may be a concern. As I stated before, I always explain that the medications take time. As I stated, 4 to 6 weeks is usually for it to take full effect. And we work closely together to monitor side effects and to find the right fit, because there is no one size fits all when you're talking medications, when you're talking treatments. So let's go and talk about non-pharmacologic treatments. So things that more so non-pharmacologic are things that you as the patient may want to use or try to see if they help lessen your symptoms. So because meds can help, but the lifestyle changes are as powerful as medication use, maybe more powerful, because if you can use those to control your symptoms, then medications may not be needed, and then you don't have to worry about side effects or other issues that can arise. So here are a few key strategies. Things like therapy. So we would use cognitive behavioral therapy. It's usually proven to help in anxious thoughts. You have mindfulness and meditation is great. There are apps now that you can use like Calm, Headspace, or Insight Timer, and just using these for 5 to 10 minutes a day has shown some relief in anxiety symptoms, as well as exercise. Moving your body every day or at least a few times a week helps to lower cortisol, and lowering that cortisol helps to decrease these anxieties, as well as other things that increase when cortisol levels are high. And also exercise itself helps with the release of endorphins, which are known as our feel-good hormones. Sleep hygiene, setting a bedtime routine, not using screens for 1 hour before bed, especially with the blue light symptoms. You need to turn that light back on because it got dark. Thank you. Trying a warm shower, herbal tea, or just journaling maybe about your day or things that you want to do, some goals that you may have. You're not overstimulating yourself, but to offer yourself something to take your mind off whatever it is that's causing you to be anxious will help. Limiting caffeine and alcohol. These can make anxiety worse, especially if you're sensitive to caffeine or alcohol. Breathing techniques. So there's one technique. It's called box breathing. So in this technique, basically what you do, you inhale for 4 seconds. So you take a deep breath in over 4 seconds. You hold it for 4 seconds. And then you exhale for over 4 seconds. Then you hold again for 4 seconds while off of the exhale. And then you repeat that. It signals your brain that you're safe. So it grounds you basically. So questions, quickly before we go into question segment. What I tell my patients, if you're struggling, you're not alone. There is nothing weak about asking for help. First off, anxiety is common, it's treatable, and it does not define you. My job isn't just to prescribe. It's to partner with you. We find a mix of tools that work for your life together. So it's not just me prescribing and you taking the medications and that's going to fix all your problems, but it's us doing the pharmacologic and non-pharmacologic things that can help decrease your symptoms so that you can be your optimal self in your everyday life. That's my job and your job together, right? So question and answer segment or tease. And then I'm going to get out of here so you all can go about your day. I just wanted to drop a few tips about anxiety since we are ending May, which is mental health awareness. So if you have questions about anxiety or mental health, you can DM me or drop a comment that may lead me to be able to do a follow-up video. I want this segment or these episodes to end up being a live. Well, it's not live now because I'm just starting. This is our first episode. So I want it to become a live that is weekly, and I'm thinking Tuesdays at around 8 o'clock will be when these episodes will come out weekly. So, and each week it will be a different topic. We'll talk about different things. And I'll also be able to either answer your questions that you may have about a condition then, or I can find the answer and then make a response video, because if it's a question that many people may have, it may be better returned to you as a full video. So we'll see what the questions are, if they are specific to you, or you have something that you need taken care of as far as seeing a provider. I do offer telehealth if you're not in my area, which I'm located in Charlotte, North Carolina. I do offer telehealth, and you can book those visits on my website at arsmedicalplc.com, that we can address your needs for these symptoms or any of the conditions that we talk about along the way. You're more than welcome, and I will be glad to help you in any way that I can. So if you have any questions, drop them down in the comments, or you can DM me if it's specific just to you and you don't want to put it in a comment, but someone else may have that same question. So like I said, I'll make a response video, either answer your question once we start going live each week, which is hopefully what will happen. I'll continue doing these segments until we have people that are on there subscribed to the channel that I can go live. So you subscribe if you like these types of videos and you would like to watch them live, and that will let me know that I should keep doing these, and then we can turn them into a live session each week, which I like that better, because we can actually dialogue versus me talking and not having a response at the moment. So I like to talk back and forth a little bit better. Not saying that I may know all the answers to the questions at the time, but if it's a question that I will give whatever information I currently have, and I will follow up with if I think that question needs more detail. And so that's what I'll do. Okay, so let's just wrap this up. We kind of went over anxiety. Like I said, if you have any questions or anything, DM or drop a comment. Let's see, we'll be talking our next episode, which will it still be May? I think it will be. No, it won't be, because I think the end of May is, when is the first? First is Sunday, so it won't be, but we will continue on. We'll probably, more than likely, we will talk about depression. I think that will be what we will talk about next week. And then we'll continue next week, and then I'll tell you what the next topic will be. Or if you offer any suggestions, that may be the response. So if you can drop the comment or the condition that you may like to see the live on by this Tuesday. If you can comment it by Thursday, where I have time to prep the slides for with any information that I would like to put on there, that would be greatly appreciated. If not, I will continue with my plans of what topics will come next. So don't forget to subscribe, share, and take care of yourself. Your peace is not a luxury, right? It's a priority. So I will see you all next Tuesday at 8 o'clock. Bye.